Good morning, and thanks for coming. We're going to start our training today with some massage ball work. There are a few areas that I always like to attend to. The pectoral muscles here in the chest, and particularly under the arm around the humerus, your arm bone, to make sure that we can facilitate good movements through our upper body when we do our upper body lifting. And on that, we'll go to the floor and do alignment work. So the best way, if you could be in a door frame, you can do this against the wall, but door frame is a little better for your head angle. And the ball is just along the bottom edge of the collarbone, but make sure that you get into the junction of the sternum, the chest bone, collarbone, and first rib. Right into that little corner, and then work your way out toward the shoulder. And let your head be really relaxed. The head should be turned always away from the ball. And the palm of the hand, so to externally rotate the shoulder, the palm of the hand should be facing forward. Like not this way. People often internally rotate the shoulder. You need to externally rotate to expose the pecs. Then work on the other side. And if you can see the arm angle here, the palm is forward. And when you get out to the side, right around the humerus, you wouldn't roll on the bone itself of the shoulder, but on the soft tissue, the tendon attachments of the pecs into the shoulder area. And if you can lift your arm up and right here by your armpit. And if you can't do that because of restrictions, not to worry, right? You just keep massaging out those tissues. All right, and next we're going to work on the feet. Just rolling the ball around here in our arches. We're going to do a little more of that later. So we'll just do that a little quickly here on the other foot. Great, and next we're going to move down to the floor. If you don't like being on the floor, then you can do this in the bed even. Although there is real benefit to getting up and down off the floor. Besides the fact that you want to do it, there are tremendous core benefits and strengthening components involved in that action. All right, now we're going to need the massage ball again, a broomstick, and a strap for a hamstring stretch, and a foam roller or rolling pin. I'm always diligent about making sure we release our quads, which become tight from sitting, walking, standing upright. Okay, so to start out, I'd like to begin, or continue, would say, with the shoulder girdle complex. And now we'll work on the upper trapezius. So here I'm on the right side of the upper traps, right at the base of the neck. And if you just bring that arm up, the right arm up, and it seems right leg straight, that helps to release that tightness a little. And work right along the crease where the tendon attachments of the upper traps work into the spine and the neck, the cervical spine. And then we'll work more into the belly of the muscle, and you might, you can roll around a bit, or you can just press down. A part of the massage ball work is, you get circulation, you release tightness somewhat, but we would also like to remold our tissues, like better sculpting of our joints. And next, further out toward the side, and you'll hit your shoulder blade, your scapula, and you can move around along the edge of the shoulder blade. If you find a line that's a bit sensitive, again, you might just put pressure onto it. Great, and then we'll work on the left side. starting at the base of the neck. A left arm up and left leg straight. You can also do this kind of work standing with your back to the wall, and you can put the ball inside a sock and just roll up the tissues in the upper back. I'm more specifically focusing on upper traps. Okay, and now in the thicker part. Okay, and then further out to the edge around the shoulder blade. You might move around a little or just put pressure. And you can spend a lot more time here working all around the shoulder blade, all around the upper back, massaging the back of the neck. But we're just going to move on and work next on the hips. So if you take the ball in the left hand and you lift the left hip up just a little bit, and then the ball is on the outer edge of the back of your hip, straighten the leg. And you can still be lying quite comfortably on the floor, but tilt the hips so the ball sinks into the socket of your hip joint. In here, what you should net sense is your femur. That's your upper leg bone. And there's a little gap, that's the socket. And then further in will be more the thicker part of the glutes. So here we're on the tendon attachments around femur. And if it's very sensitive, you know, again, you would take more time and put some pressure, hold the pressure a little. And then we'll just move on now to the other side. And the right hip up a little, leg straight, and turn up on top of the ball so it sinks into the socket. Of course, you're trying to keep your leg relaxed. And just wherever you feel there's a tight line, you just can let the ball sink into it. I think driving is a big factor, and it's very common for the outside of the right hip to be quite sore and dense. So if you relax the leg and let the ball sink into the joint, it'll help break up that dense tissue. And of course, if it's like that, very dense and thick, or if people have like fallen down, right, and the fascia, you have some scarring in the joints capsule. All right. Next, we're going to put the ball just in the back of the head and work on the spine, just some gentle things for your neck and decompressing the spinal column. And first, just relax the shoulders back, and then we'll gently nod. With this preparation series, we're just getting our body ready for our lifting exercises, the weightlifting, resistance training. And also we'll include different agility maneuvers so we can have a really complete workout. And now hold with the chin down and just take a deep breath. And of course, belly will lift, true, but also see if you can expand the waist, expand the ribs to the sides, to the back. Okay, and nodding action. And a deep breath, and keep that right leg relaxed. And now this time, keep the chin down and let only the eyes move up and down. And that action will help to release the muscles, the suboccipital muscles in your neck. And a deep breath. And one more time, eyes up and down. And a breath. Okay, we'll leave the ball for now. And then if you could take the strap for the hamstrings under the right foot, take both ends of the left hand, wrap it around the back of the calf of the right leg. Now the right hand is holding on. Now don't overstretch your knee, so if your knee's a little bent, that's okay. But set so the knee's over the hip joint, and then we're just rotating the femur in and out in the socket of the hip. unwind and just do a stretch here. Always checking that the toes and the knee are pointing straight back, that there's no twist in your knee or ankle joint. Okay, and now we'll switch left foot. So strap goes first right hand around the back of the calf and the left hand. Knee over hip, and then just rotate. So like a stick, if you had a stick that was very stiff, and you just spun it like this a little in and out, it would make a hole in the ground. So we're clearing our hip joint. And very gently, not forcing ever. Okay, unwind and just stretch a little. Okay, and strap down. And next, the broomstick. The right leg is knee over hip joint. So the broomstick is in the hamstrings of the right leg, and pull the left leg up into the bar. So you're pressing with left quads. So legs are pressing opposite directions, helping to even out your pelvis. Okay, reverse the leg position. Your best is if the arms are straight, shoulders down, and chin toward the throat. It does take some conscious effort. And if you need something for your head, right, you don't want to strain here to try to get your head on the floor, put something under, but, okay, broomstick down. Always the chin should be like pulling down, so the neck is lengthening at the back. Too much of us, our necks are hyperextended from our computer work. So next, arms out in the wide angle, palms face up. And those of you who do this regularly, you know how much better it is. Like when we started, maybe a lot of people have numbness and tingling and down their arms, and that clears. Next, imagining a big stability ball that's on your abdomen, and you want to wrap your arms and legs around the ball, but really envision it there so that you're holding it in place as you rock side to side. And also, people who are new, often at the beginning, the core rotational stabilizers are weak. So when people do this, the back really arches out. So as you're rocking, your spine should be always neutral, no shifting around and lower back. Okay, and just relax for a moment here. And then arms up to the skies, elbows bent, legs up. So this is a modified dead bug position, shoulders down from the ears, chin down, right leg push forward a couple of inches and hold. And left leg, here you should be feeling abs, not quads. If you feel your quads, they're just a little too sore and tight, bring them back. Right leg a little forward, hold. And left. Also, you shouldn't feel that in the lower back. If you do, you just kind of hold position and don't move. Okay, and turn on the right side. So right leg is straight. Lying right on the right side with the left hand, you reach back toward the right foot. A right hand on the left knee. This is our spinal rotation position. Just make sure the shoulders back and the knee forward are equal distances from the floor. Okay, turn the other way. Right leg forward, left leg back, and your right hand reach in toward your left foot. I'd like to have chin toward the left shoulder. And be careful of just rolling the right knee forward. Same height from the floor as the right shoulder.